Thank you very much. Hope everybody is keeping well and safe, and welcome to the session. Thanks for having me. Can I confirm that everybody can see my screen and that you can also hear me?
That is correct.
Perfect. Thanks. So my name's Thayendran Naidoo. I'm the ConvergeHEALTH Africa leader for Deloitte. And what I'm going to share with you today is just around the digital transformation that we're seeing within the healthcare industry. And to kind of start off, I'm going to focus on looking at what disruption looks like within the healthcare sector. So, I mean, we've all seen a version of this slide at some point. It talks about how technology has evolved and how it's the exponential growth. But for the healthcare industry, what does this actually mean? It means that firstly, data sequencing has gone from $1 billion in 13 years to 100 million in less than an hour. Moderna has been a perfect example of that. A company that has been set up as a biotech company. And when COVID-19 came about and the RNA sequencing was made available, they were one of the quickest to develop a vaccine. And that is not necessarily because they've been in the right place at the right time, but they planned and they set up their organization to cater for such an event. If we look at the proliferation of mobile phones, we're getting more and more individuals that are starting to move into smartphones across the globe. And with this comes a whole host of additional services, additional access to services that they never had before. And I think one of the key things to kind of understand is that there's a very big differentiation between digitization and digital disruption and providing new digital services. I mean, if we think about email was probably considered, a great means of communication, but it wasn't actual digital transformation. It was just digitization of a method of communication. Whereas something like a WhatsApp messaging or WeChat is a true form of digital transformation, where you've got this very specific individual conversation that can happen within with one individual, groups of individuals. So like that, within the healthcare sector, we've started to look at how is digital disruption and digital transformation going to affect the healthcare industry. And what we've effectively put down is what we think is the 10 areas that are going to drive the future of healthcare in 2040. And these trends are focusing on, firstly, affordable healthcare for everybody, having a movement of healthcare to well-being. And we've seen this with certain companies in South Africa and globally, where they've shifted the focus and they've shifted the onus on the individual to stay active, to stay healthy, and they've incentivized that. And we're seeing that this is going to be one of the global trends moving forward, is that how do you now get individuals to give more consideration and have more interest in taking care of their bodies, taking care of their health and their family's health. The next one is looking at interconnected health communities, and this is where platforms become a massive contributor towards this particular trend. And then that evolution of a trusted patient-caregiver relationship is also going to change. And this is where we start looking at how digital transformation can potentially bridge that particular gap. How do you put the capabilities of the accessibility of a healthcare provider to an individual that sits in a rural community that doesn't necessarily have the ability to reach their healthcare provider in a timeless or in a frequent basis? How can we use digital transformation, technology, AI to bridge that particular digital divide that we're seeing? I think personalized care is another area. Through these digital mechanisms, you're going to start seeing more tailor-made, personalized treatment plans that are only going to come about because of the frequency, of the increased frequency of the healthcare provider and the patient themselves, where a patient is able to say, through a USSD, through a mobile app, through a whole host of data inputs, this is how the treatment is affecting me, doctor. This is how I'm responding to this particular course of treatment. And then the doctor or the healthcare provider can then change or alter their treatment plan according to that patient's feedback. Another key aspect is all of this is dependent on how we actually accelerate digital health and the data that's used for these different aspects. And then with that comes the regulation. And it's always been a case that the regulators have always played a bit of a catch-up game when it comes to technology, when it has come to digital transformation. And that is also something that we see is going to be a trend going forward. But with this new information that's being generated and being captured throughout this entire ecosystem, you start raising a lot more questions on who actually owns the data. Who's going to be the owners and the custodians of this data? And with the POPI Act also coming into effect, fairly soon, how do you then manage that particular data within an environment that is safe and secure, that actually protects the individual's rights to that particular data? And then lastly, with the host of this data, with the host of accessibility, we're going to start seeing more personal and cognitive AI that's improving patient outcomes. How do you now leverage the information that's been provided and have algorithms working in the background to compare patient X and patient Y to understand the symptoms, run that through a model, and have more accurate recommendations for the healthcare provider to actually change or adapt a particular treatment plan based on empirical evidence, based on data that they're seeing with other patients. And just to put this in a slightly different frame, as I said, the core of this is going to be the data and the platforms. And with that, the information that comes through this in a radically interoperable data platform. You need Hospital X being able to speak to Hospital Y, even if they're in two different networks. You need to be able to move from one healthcare practitioner to another without having to cart a massive file with you. And each healthcare practitioner has been able to actually look up, with your consent, your historical medical records. And then from that, new variants or new methods of well-being and care delivery, as well as care enablement, are going to be devised, because now you've got access to the patient in a very different medium, in a very different form, that you're able to then prescribe and look at how you can effectively improve those patient outcomes through the means of new digital channels. And when we look at what these archetypes are for the future of health, we see, along the three very distinct groupings around the data and the platforms, the well-being and the care deliveries, as well as the care enablement, each one of these come with its own host of challenges and advantages that the patient's going to benefit from. For example, the data science and the insights engine that's going to be available to a healthcare practitioner with their particular patient base, as well as an anonymized set of other patients that are having similar symptoms, massively improves the ability of the healthcare practitioner to be more effective in how they treat that particular patient. And when we look at the personalized and virtual healthcare actors, providing a more fluid and more frequent mechanism to engage with the patient becomes vitally important. And then you also start looking at some of the localized health hubs. So this serves as an in-person connection for the communities, for education, prevention, treatment, and also to make it more convenient for them to receive their healthcare treatment in a manner that's more efficient and in a more convenient and trusted environment, without having to go wait at a clinic for the whole day for a 15-minute consultation. And then this also looks at how you actually redefine the care enablement. And this comes with looking at how do you bridge that gap between the supply chain, making sure that you have the right medication, the right fulfillment or medical devices at your fingertips, so on and so forth. Now, all of this is great, but the one real disruptor that's hit the healthcare sector in the last sort of 2 years is COVID-19. And one of the things that COVID-19 has brought this accelerated disruption to the healthcare industry. And, we've heard this term floating around in terms of the next normal, just from a COVID perspective, or the new normal. It's the same thing that applies in the healthcare sector. We're starting to see more and more organizations globally move towards a shift towards telemedicine, to a digital front door, to having more flexible scheduling approaches. I mean, we're seeing this now with our vaccine rollout as well. There have also been companies within South Africa that have looked at how do we put forward virtual care pods. So you have these mobile clinics that also provide more access to telemedicine, where you've got a healthcare practitioner being able to diagnose and treat a patient in remote locations. And then throughout all of this, you've got home monitoring and what we define as tele-ICU. But throughout all of these pieces, technology and digital is at the core of this piece. But why is it when we look at we look at Africa, we don't see these trends? I mean, I've got 3 slides here. This is firstly on Southern Africa. And this is taken from a publicly available site around COVID cases, and slightly dated. It's about the 10th of May, 2021. And for each of these countries that we've listed in Southern Africa, we've looked at the total population, the total cases of COVID or confirmed COVID cases, the total deaths in that country, and then how many doses of the vaccine have been administered in that particular country. And when we start looking at this, most of these countries are hovering about 1 or 2% or even lower of their total population when we start looking at the doses administered. And this is not even taking into account that certain vaccines need a double dose. So the doses administered doesn't necessarily correlate to a total number of individuals vaccinated. When we start looking at East Africa, again, we're seeing a similar trend. When we look at certain countries, for example, in Burundi, we see 0 doses administered. And again, this is taken at the 10th of May. Same thing with Tanzania. And it starts to raise certain questions to say, is it a question of there really isn't any doses that's been administered in those countries? Or is it a question of the data quality and the data flows have not necessarily progressed to a point where we can actually make meaningful decisions and have insights based on these numbers? And the last slide, again, very similar picture. Most of the countries in West Africa, again, sitting at the low single digit total of doses administered from a vaccine perspective. So with all of these great trends that we are seeing, the future of health, and we're looking at what healthcare can bring to the healthcare market, why is it that within Africa, across Africa, we're seeing such a low prevalence of vaccines that are coming through? And bearing in mind, when we start looking at COVID vaccines, there are some external factors that not necessarily taken into this particular argument in terms of the availability of vaccines, the ability of certain first world countries to place orders and almost stockpile certain vaccines. But we would have thought that as an African continent, we would have been a lot more progressed in terms of our vaccine rollout than the rest of the country, given that COVID is right here and it's one of the areas that's focusing us on massive digital transformation and massive transformation as a whole in the healthcare sector. But it's not necessarily happening. And if we look at this particular table, those countries that I've listed in the last 3 slides, we've got a few dimensions that we're looking at here. The first one is looking at the quality of the COVID data that's available. Now, in certain instances, we were able to go and do desktop research and actually find COVID-related daily information for that particular country. It might have not necessarily been, as the frequency that we wanted, but the information was publicly available. In certain instances, we couldn't find any of that information at all. And in most instances, we weren't sure whether that information was available or not. And that's the reason for so many unknowns. And this, when we start looking at the next couple of variables in terms of the vaccination strategy, most of these countries have a vaccination strategy. They have transition plans to move towards electronic medical records. But when we start looking at the doing business and the corruption perception, looking at these two particular scales, noting that the doing business scale, 1 is the best, whereas in the corruption perception, 0 is the worst. We see a whole array of challenges that are coming through, and this is because what works in the first world country doesn't necessarily work across Africa. There are certain aspects where we can take the learnings from the first world and global implementations and global lessons learned and be able to skip a few of the steps that would have taken us a long time to deploy within Africa. But there are certain instances where that just doesn't work out. If we look at a lot of these countries, there's a real appetite to move towards electronic medical records, but the funding isn't there. They're at the mercy of global funders such as the Bill and Melinda Gates Foundation, and the global funds and various other global initiatives that are throwing money. And if those organizations put money towards these specific areas, then you're getting the traction that we'd like to see with these countries. But if there's no funding, there's no real budget for this in each of these countries. This is why across Africa, there needs to be a very different thinking and approach that needs to be adopted as to how you can start putting forward tangible, safe, and meaningful solutions that's going to actually improve the lives and help with some of the very big challenges that we have across the continent. We need to start looking at what are the more innovative funding mechanisms that are available. We need to start looking to see how that reliance on the global funding starts to shift. More visibility needs to be there to help reduce corruption, so that when we ensure that a lot of these funds are being put to certain countries, that we can actually see and there's transparency around where these funds are being used and how they're used. I think 2 other aspects is around the health system strengthening and improving the data collection and quality. Many of these countries still rely, as does South Africa, on a paper-based movement of information and data. They've not necessarily adopted or been able to adopt more digitized opportunities for healthcare. And then I think there's a lot more willingness from many of these countries to actually transform, but there's a whole host of these issues that we need to start looking at first. So
Thayendran, I'm going to be the dreaded timekeeper and wind you down to the last minute or so.
Perfect. This is my last slide. So I mean, if we look at how market players can actually respond in this space, the incumbents need to kind of really drive innovative solutions and drive transformation. There's a little bit of a resistance to change and disruption from that perspective, while new entrants into this need to start looking at the full business case around it. It's very expensive and costly, and you need a whole host of technical expertise to actually penetrate these markets, whereas doing a partnership model or a local stakeholder model with many of these organizations across the African continent, you'll get a lot more traction in terms of how you actually build out solutions that are going to drive digital transformation, that are going to drive improved patient outcomes, and ultimately bring the population of Africa to a point where they have free, or not necessarily free, but where they have more accessible opportunities for healthcare treatment. Perfect. Thank you so much.
All right. Thank you so much, Thayendran. A very informative presentation there, looking at digital transformation and converged healthcare. That is Thayendran Naidoo, who is from Deloitte. We are going to hear a quick word from our sponsors, and after that, we're going to take a 10-minute break and then reconvene to hear our keynote address in the next 10 minutes.